Easy.
My love and my primary focus is on the surgical treatment of arthritis, joint replacement.
Okay, so let's talk about the two big joints, I guess. That'd be knee and hip replacement. I read something here that called you, I told you I was going to ask you about this, the specialist who's performed more hip and knee replacement surgeries than any other surgeon in the state of Florida. And I said, people track these things? You said, yeah, they sure do.
The state tracks it. You know, they track everything. And so there's the website, a state website, floridahealthfinder.gov, that details the number of joint replacements that every surgeon in the state does. And for the past 5 years, I've been at the top of the heap in terms of the number that I do. Now, what does that mean? Well, I guess it means more than anything, volume correlates with quality.
Okay, so high volume means high quality.
Yes.
What you're saying there. Well, let me ask about this. How prevalent are the injuries when we're talking about knee and hip related to arthritis? And then what's the impact? Because it's not just on that individual who needs that treatment or surgery.
You're right. I mean, it's a medical condition, and it's becoming more and more prevalent. You know, we're an aging population. There are more people older than 65 than younger than 65 right now in this country. And every year that it continues to increase, the number of patients with arthritis continues to increase. Of the patients who are older than 65, 1 in 3 have disabling hip and knee arthritis. 1 in 3, that's millions of patients.
Yeah, so is there treatment beyond I need a replacement? Is there something I can do to prevent arthritis?
Of course there is, and those are the things we struggle with and try to address in the younger population. You know, if you have an injury, try to protect that injury by cross-training and things like that, so that the joint will last longer. And the treatment of that is, you know, initially conservative with medications, activity modification, injections, things like that. But when those things fail and you're left with an end-stage arthritic joint, and it affects not only the patient and maybe their workplace, but also the patient's family, who has to take off work to help provide care for that patient. I mean, it's huge, and it's a huge debt to the healthcare system.
So last thing, and I've got less than a minute here for your response, but I understand that the research component to your effort is working with Stryker Corporation. What does that do? How does that involve?
Well, Stryker is one of the big joint implant companies that make the implants. I guess research to me is critical in this, and if you have a research institute, you keep track of everything, of any small change you may make, of the design of the implants, and you can help improve the quality of care provided to your patients.
Dr. Heekin, I appreciate it. Glad to hear about that passion, and I appreciate your service to the nation. I know in 1991 you're back in serving our country as a physician for the Army, so thank you very much for your service.
Thank you.
All right, well, this week in